If your orthodontist says you need 4 perfectly healthy teeth pulled for braces, you should run. I'm Dr. Coral too. I'm an ear, nose, and throat surgeon here to help you breathe better and live happier. Today we're discussing teeth. The shape, number, and position of your teeth can affect how you breathe, how you look, and how your jaw works. If your teeth are crowded and crooked and you go see an orthodontist, there's a good chance that orthodontist will recommend that you have 4 healthy premolars or bicuspids removed. This makes room for moving and straightening teeth, and pulling teeth can help you get that straight, beautiful smile you want, but it comes at a very high cost. There's really no need to pull healthy teeth now that we have far better alternatives than in the past. I'm going to give you 3 reasons why you shouldn't have healthy teeth pulled. Number 1, extracting 4 healthy teeth makes your breathing worse. When teeth are pulled, you lose bone. Bone loss leads to less space in your mouth. And very often, the reason your teeth are crowded in the first place is because you don't have enough space in your mouth. Instead of fixing that core problem, dental extractions make it worse by further reducing the amount of room in your mouth. Look up at the roof of your mouth. Is it wide and flat? If this is your palate and these are your teeth, you want lots of room around your palate for your teeth. If the palate is pushed up and narrow, the teeth, which are along for the ride, become closer together and crowded, and the palate itself becomes less wide. A high, narrow palate is a big problem because now your tongue doesn't have room to sit up flush against the roof of your mouth. If your tongue can't fully contact your palate, it'll fall back during sleep and block your airway. This low tongue position also creates mouth breathing and weak lip and chin muscles. So a high, narrow palate leads to dental crowding, sleep breathing problems, and problems breathing through your nose. The roof of your mouth, the palate, is the floor of the nose. A peaked roof means the palate is now encroaching on the nasal airway, which creates less room in the nose for breathing. The reduced volume of the nasal airway also causes terrible sleep and snoring. A high palate can even cause the nasal septum, which is the middle wall inside the nose, to buckle or deviate, further restricting nasal airflow. So the number 1 reason not to have 4 bicuspids pulled is because it worsens your breathing. The number 2 reason is that pulling teeth without correcting the underlying problem leads to TMJ problems. If you feel right in front of your ear here when you open and close your mouth, you can feel the temporomandibular joint, or TMJ. Many people who snore or have trouble breathing at night have problems with the temporomandibular joint. I see ear pain in my clinic all the time. That's actually TMJ dysfunction, not an ear problem at all. If your tongue is falling back and blocking your airway while you're sleeping, your brain is going to move your jaw forward so you can breathe. This is called a jaw thrust. We do it all the time when patients are coming in or out of anesthesia. It brings the tongue forward to open the airway. But it's hard for your body to hold that position all night, especially if your tongue is weak or you can't fit it up against your palate. So you'll grind your teeth. The other thing your body might do at night to open your airway is clenching your teeth. If your airway is very narrow because teeth were pulled or your jaws never fully developed forward like they should, it's very easy for that tiny coffee straw airway to collapse when you're asleep. Clenching is your body's defense mechanism to maintain tone and tightness in the throat muscles to keep that little airway open. So you're clenching and grinding your teeth all night, putting tons of pressure on your temporomandibular joints. Not only are you going to have chipped and broken teeth, but this bone that's actually part of your jaw, called the condyle, will wear down quickly and become shorter. As that happens, the jaw, instead of sitting nice and square with this great jawline, the jaw starts to sit like this, which further narrows the airway back here and puts more pressure on the TMJ. This also creates an elongated face and that oblique jawline. So the number 2 reason not to have 4 teeth pulled is because it causes lifelong worsening TMJ problems. The number 3 reason is that pulling your teeth changes the way your face looks. The aesthetic ideal is a sharp jawline, a full gorgeous smile, prominent cheekbones, and robust youthful features. Pulling teeth creates a long narrow face, a worsening weak jawline, sunken eyes, and deflated worn out features. The bone of your face is the scaffolding for your skin. You should absolutely fight to keep all the teeth you can to maintain your facial infrastructure. All the Botox and filler in the world can't overcome poor underlying bony structure. So what are you supposed to do instead of pulling 4 teeth? Palate expansion. Palate expansion should be the go-to choice for patients under 18 with crowded teeth or a small palate. By making more room in the mouth, palate expansion actually makes more room in the nose, not less, like dental extractions. If you're over 18, unfortunately, your bones have stopped growing and the growth plates have likely fused. So now expansion is a lot harder and it may require surgery. But palate expansion is still far better than pulling teeth. Expansion can create a nice, wide, beautiful smile, straight teeth, more room in your nose for breathing to help prevent sleep apnea, gorgeous wide cheekbones, and a sharp jawline. Pulling teeth is the opposite of that. It doesn't do any of that. It'll give you straight teeth, maybe for a little while, but it's going to make everything else worse. Pulling healthy teeth can't do anything for your airway or your TMJ. You're going to have to fix those later when you're older and the damage is more severe and way harder to repair. So if your orthodontist says, I want to pull 4 healthy teeth for no reason, sometimes there is a good reason for your health, but the vast majority of times there's not a good reason. Don't do it. Go find an airway orthodontist and get a second opinion. If you find this content helpful, please click like and subscribe so I can continue making material for you. Also, leave me a comment and let me know what other topics you'd like me to cover. I'm Dr. Coral 2. Breathe happy.